Hello everyone. Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. So we are from small group discussion B5. We will present our student project entitled Autism Spectrum Disorder. Next. Okay, this is our member groups, and the presentation will be continued by my friend. Thank you the presentation.
Hello, my name is Nipudunita Aristani Dewi and my identification number is 2002511138 and I would like to explain about the background. Every parent wants to have a healthy child. Not only physically, this definition of healthy also includes mental and social conditions. However, not all children can grow up like that. There are children who show symptoms of developmental problems from an early age. Children with problems like this are often called children with special needs. This child may have difficulty communicating and interacting. One type of child with special needs that has been heard a lot lately is Autism Spectrum Disorder, ASD, or commonly known as autism. ASD is a complex neurodevelopmental disorder with impairments in social communication with restricted and repetitive behaviors. This disorder is generally seen in the early years of life and then tends to persist throughout their lives. Until now, there is no definitive data on the epidemiology of autism in Indonesia. However, it is estimated that the number of people with autism in Indonesia is increasing. The incidence of ASD is known to be caused by various factors. Several factors that are closely related to ASD are genetic and environmental factors. People with ASD certainly need support from family and people around them. Healthcare for people with ASD is quite complex, so the accompanying family needs to have a good understanding of ASD. The insight of health workers and collaboration between health workers and family is very important to be improved. And that's all about the background. Thank you.
Hello, my name is Bagus Agung Saputra Aryanugraha with student number of 20025111219. And now I'll explain about the problem formulation, namely, what is the definition, the pathophysiology, the etiology, the epidemiology, how to diagnose, how to treat patient, and how to prevent autism spectrum disorder. I'll explain about the objective of this student project is to know about the definition, the pathophysiology, the etiology, the epidemiology, to find out how to diagnose, how to treat patient, and how to prevent autism spectrum disorder. And now, the benefits of these student projects are have the knowledge about autism spectrum disorder, have useful theory for future medical practice, improve the knowledge of the community in autism spectrum disorder.
Hello, my name is William Alexander Hatanto and my student ID number is 2002511011. And I would like to explain about the definitions of autism spectrum disorder. ASD, or more completely being called autism spectrum disorder, can be defined as a complex developmental disability associated to brain development, which brings continuous challenges in nonverbal communication, social challenges, speech, behavior challenges, for instance, restricted interest or repetitive behavior, which its severity cannot be determined as each person differ in terms of its severity of the symptoms. The difference in terms of severity and symptoms that people undergo makes autism well known as a spectrum. The variety of severity of the person with autism spectrum disorder makes a variety of dependency. For instance, some people with ASD might have less dependency if the symptoms are less severe compared to the people with more severe symptoms, which makes them less independent. Therefore, need a lot of assistance to fulfill their daily need. So, the level of impairment and its impact to daily activity usually used to determine the severity of ASD.
Hello, my name is Simanda Satriananta and my student identification number is 2002511071. And I would like to explain about the pathophysiology of ASD. In general, the exact mechanism of ASD is not well understood due to its heterogeneity. However, several theories have emerged in order to answer this question. A cohort study following infants has shown that infants who develop ASD later on during childhood have distinct profiles in their faces and eyes at 7 months of age. They also have a slightly different EEG and other measures of brain function. This study further suggests that ASD arises because of an reorganization of brain early on during development. With that being said, the current leading theory about the mechanism of ASD is the dopamine hypothesis. This theory proposes that two subpopulations of midbrain dopaminergic neurons that governs function that is usually affected in autism could be modulated by dopamine. This includes the mesocortical limbic circuit and nigrostriatal circuit. A dopaminergic dysfunctions in this circuit could ultimately lead to manifestations of symptoms of ASD.
Hello, my name is Rizky Purba and my student ID number is 20025111158. I would like to explain about the etiology of autism spectrum disorder. So, autism spectrum disorder is a neurodevelopmental circumstance of heterogeneous etiology. Researchers agree that genes are one of the causes in ASD. Example, patients who have a sibling with ASD also have a high risk in getting ASD. And people with genetic or chromosomal conditions such as a Fragile X syndrome or tuberous sclerosis could have a more risk in getting ASD. And ASD more likely to be found in children that born from older parents. Besides genetic, such as the drug use during pregnancy, example is use of valproic acid and thalidomide at pregnancy may cause the children in the womb have a high risk of ASD. And child with immunologic incompatibility. In the womb, autistic child lymphocytes react with their mother's antibodies and have a risk in damaging the embryonic neural tissue. This suggested autistic disorder caused by immunologic incompatibility. And next is child with prenatal and perinatal complication. And last is patient with problem in the CNS. So multifactor that happen in the CNS can cause the behavioral syndrome in ASD.
Hello everyone, my name is Dipo Tolansi Widiantara with my student number is 2002511173. In this session, I will explain about the epidemiology of autism spectrum disorder. Okay, the distribution pattern of autism spectrum disorder is classified based on two things as follows. First, case rate of prevalence. SD increased over the last 2 decades and arise in the early stage of development, but in most cases, the symptoms experienced by some children are not detected until they are much older. The time interval when symptoms appear until the phase when they are diagnosed with ISD, which cause the distribution and prevalence to increase over the time. Okay, number 2 is gender. Men are 4 times more bound to get ASD than women. However, when compared to the clinical samples, women with ASD more often show intellectual disabilities than men. Okay, that's all from me. Will be continued by my friend. Thank you.
Hello, my name is Ikadas Namibawa and my student ID number is 20025111032. I would like to explain the diagnosis of autism spectrum disorder. Next. In diagnosing ACD, there are 3 things that can be used. The first, history taking. In principle, the analysis relies heavily on information from parents of ACD sufferer, mainly covering speech or language skill, social interaction, and playing skill. The second, physical examination. Physical examination of children by questioning autism spectrum disorder is similar to the physical examination of children in general, including anthropometric examination and evaluation of growth and development. And the last is the laboratory investigation. Examination according to availability of health facilities can be considered if there is intellectual limitation during the history and physical examination. In addition, electroencephalography may be considered if comorbid epilepsy is suspect. That's all for me. Next.
Okay, so first let me introduce myself. My name is Sidogun Setiapratnyani with 3-digit student ID number 044. So we're moving on into the management of autism spectrum disorder. Good management of ASD begins with a proper referral procedure and continue with the implementation of parental-based early intervention and also behavioral intervention guided by a multidisciplinary team. As for pharmacological therapy, this method is not recommended if there are no comorbid disorder, such as psychiatric disorder or neurological disorder. Referral preparation step, collecting information from the parents, followed by physical examination of the child growth and development. The information that needs to be collected mother's medical history, history of the disease during the prenatal and perinatal periods, history of childbirth, history of growth and development. There are differences in behavior and achievement of child development, early sign of autism in children, and also family ASD history. If you have suspicious your children has ASD, the doctor may continue the examination using screening instrument such as modified checklist for autism in toddlers or MCHAT.
My name is Amanda Reksa Suryananda with a student number of 2002-511-237. I'm going to continue my friend's presentation. The second one is multidisciplinary team. People who are experts in ASD may vary between hospitals due to different human resources, of course. Pediatrician can conduct general assessment and etc. Occupational therapists can play a general role in assessing fine gross motor skills and sensory process, while a psychologist can plan developmental evaluation and determine therapy planning. The third one is early intervention by parents. This model emphasizes the teamwork of parents and caregivers to build attachment with children, prevent social patterns that are too direct, and find ways of sharing attention so that children have better initiatives. This therapy usually does not interfere with the daily activities of children and parents. And also, this therapy is generally more affordable in cost and flexible in time. Forms of intervention that can be used in this category include DIR, ESI, ESDM, and etc.
Hello, my name is Juven Lufianto with 3 last digit student ID is 091. I will present about prevention of autism spectrum disorder. To avoid child with ASD, we should avoid pregnancy in older age or early age pregnancy. Second, avoid reproductive tests and gender selection, such as intracytoplasmic sperm injection. And then we should do tests for hypothyroidism during pregnancy, avoid smoking during pregnancy, eat healthy during pregnancy, especially vitamins and nutrition, and last, get vaccinated, especially rubella, influenza, or others.
Greetings, my name is Dave Christopher Manhutu, and my student number is 2002511107. I'm going to continue the presentation. We're going to talk about the conclusion of this paper. ASD, or more specified called Autism Spectrum Disorder, can be defined as a complex developmental disability associated to brain development, which bring continuous challenge in nonverbal communication, social challenge, speech, behavioral challenge, which its severity cannot be determined. The most common theory for ASD pathophysiology is the Roman hypothesis. ASD also have a heterogeneous etiology, which means a lot of factors can impact the ASD. Distribution pattern of the disorder can be divided into prevalence and gender. Clinical evaluation is the core method to diagnose ASD. A proper referral procedure continues with implementation of parent intervention and behavioral intervention guided by a multidisciplinary team are the management of ASD. Prevention for ASD are aimed for its root cause. That's all from me. Thank you.
Okay, Dave, thank you for the presentation. So this is our reference to arrange our student project. Okay, next. Okay, that's all from us about our presentation for our student project. Thank you for your attention, and we will close this presentation with thank you. Om Santi 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 Om. Waalaikumsalam warahmatullahi wabarakatuh.